Can you tell me a little bit about the workshop in Cork, Gabor?
As a registered trained medical doctor, I was a physician for 32 years. Did all kinds of medicine, from delivering babies to looking after dying people and everything else in between. What I learned in time through my observation of my patients and my practice, and also through the research literature, is that the way I was taught and the way most physicians are taught throughout the Western world is an absolutely narrow and limited and ultimately unhelpful perspective on health and illness. We see diseases as pretty much either caused externally by agents such as cigarette smoke or a virus or bacteria, or we see them as arising from genetic predispositions, but we don't look at the person's life. Whereas if you actually look at the research, not to mention clinical experience, what we know now is that the mind and body can't be separated. And therefore, our emotional lives and our psychological lives are inextricably connected to our physiology. And therefore, a person's emotional, psychological experiences from before birth in utero already until death are very much shaped by their interactions with the environment and by their emotions that are instigated by those interactions. And the immune system and the nervous system and the cardiovascular system and the hormonal apparatus are inextricably a part and parcel of a super system, which also includes the emotional centers in the brain. So therefore, in my practice, whether in palliative care, looking after terminally ill people or young people, or anybody in between, I noticed that there's certain life patterns, emotional patterns, that contribute to the onset of illness, and that in recognizing these emotional patterns and reversing them, people can actually heal or do much better with their chronic illnesses. And so if you take an example, a very famous one, the recently deceased physicist, Stephen Hawking, and I wrote about Stephen Hawking in my book, When the Body Says No, which was published 16 years ago now. He, at the age of 21, I think, was given 2 or 3 years to live. Now, he happened to outlive that diagnosis by over 50 years. Medical science, in a limited sense, has no explanation for that. But it's perfectly explainable if you understand the mind-body unity. And I actually know of people with ALS who've totally healed from the disease, despite their terminal diagnosis. Now, the point is that there's much more to our physiology in health and illness than our usual medical practice allows for. And if we take those factors into account, we can prevent and also heal or manage a whole lot better an entire range of chronic illnesses. And so this is what I'll be talking about. And by the way, this is also true of mental illness, but right now I was talking about so-called physical illnesses.